Graphicara Hill University, Dehradun School of Pharmacy present this session for medicinal chemistry. Today we will continue with the drug for parasympathetic nervous system, part 11. I'm Associate Professor Dr. Ahmed Nawaz Khan from School of Pharmacy. In the previous class, part 10, we have discussed some of the selective synthetic cholinergic antagonists like propicamide, cyclopentolate, clydinium, and dicyclomine. And we have also discussed the dicyclomine synthesis. These are the selective antagonists of the cholinergic system. Now, some more selective synthetic cholinergic antagonists like glycopyrrolate. This glycopyrrolate chemically it is 3-hydroxy 1,1 dimethyl pyrrolidinium bromide alpha cyclopentine mendylate. This is the structure, and along with the anticholinergic agent, it is also antispasmodic agent, and it also diminishes the gastric, pancreatic, and salivary secretions. Because if we know that it's a well-known action on the M1 receptor, also show some M2 and M3 activity, but the action is little unknown. It inhibits the gastrointestinal nerve receptor site, and that stimulate both the secretion of gastric acid, and it also stimulate the smooth muscles activities. As a side effects, it cause dry mouth, decreased sweating, and difficulty in urination. The next compound is propenthyline bromide. This is again the selective synthetic cholinergic antagonist, and it is methyl base 1 methyl ethyl 2 hexanthene 9 carbonyl oxyethylammonium bromide. This is the structure of this propenthyline bromide, and it is available as a white or yellowish white powder, slightly hygroscopic, and soluble in water, alcohol, and methylene chloride. This propenthyline bromide has a high ratio of ganglionic blocking activity to the muscarinic activity. That means it acts on the ganglionic as a ganglionic blocker, and ganglionic blocker is part of the nicotinic receptors. Now it is also used as an antispasmodic and in the treatment of the peptic ulcer. At the high doses, it can block the skeletal neuromuscular junction, and these neuromuscular junction they are on the nicotinic receptors. So also because it has a muscarinic activity, so it's act on the M1 receptor. Now isopropamide. The isopropamide is an amino amide which occur as a isopropamide iodide in the form of salt. Chemically, this isopropamide is 3-carbamyl 3,3-diphenyl propyl diisopropyl methyl ammonium, and it is a pale yellow in color and bitter taste crystalline powder. It is soluble in water, chloroform, and alcohol. It is a very potent anticholinergic drug and antispasmodic and antisecretory effects. Also used in the treatment of the peptic ulcer. Very well known action on the M3 receptor, do some action on the M4, but it's still unknown. Now procyclidine hydrochloride. This procyclidine hydrochloride is a R or S form 1-cyclohexyl 1-phenyl 3-pyrrolidine 1-ol while propanol hydrochloride. This is a very effective peripheral anticholinergic amino alcohol derivatives, which is available in white crystalline powder, which is odorless, and it is sparingly soluble in water, but soluble in ethanol, practically insoluble in acetone and ether. Very important use is in the Parkinson disease, but also along with the Parkinson disease, it is also used to control the extrapyramidal reaction, which occurs due to because of the antipsychotic agents. Well-known action on M1, M2, M3, and M4 receptor. It is very selective for these 4 receptors: M1, M2, and M3, and M4. Now, how can we synthesize this procyclidine because it's very selective for the M1, M2, and M3, M4. So this is the synthesis of this procyclidine hydrochloride. This is prepared by reacting 3-pyrrolidinyl propionphenol with a Grignard reagent. This is cyclic Grignard reagent, which is cyclo-Grignard reagent, cyclohexyl magnesium bromide, and that yield the procyclidine, and that is further treated with the HCl to form the procyclidine hydrochloride.